Shaping the Future, a policy dialogue on population dynamics in Sri Lanka, organized by the Ministry of Finance, Economic Stabilization and National Policies and the United Nations Populations Fund. Next, we have the much anticipated launch of UNFPA's State of the World Population Report. This report will offer valuable perspectives and data on population dynamics. This report is a comprehensive resource that delves into the latest trends, challenges, and opportunities in global population dynamics.
But people are now prioritizing their health and well-being, and also the opportunity of that child that they have to live in a world that is sustainable, that thrives, and that where every girl has an opportunity to achieve her fullest potential over giving birth for the sake of a country. And these are the things I believe we should look at.
We need to convince the policymakers the importance of investing in human capital. Education, healthcare and social protection systems need to be prioritized to ensure that our people, regardless of their age categories, are healthy, educated and capable of contributing to country's economic growth.
We've spoken about low fertility trends, migration. These are issues that continue to permeate our public discourse in the last 2 years, basically.
So now the migration trend has picked up. So it's going in a good trend and the trend looks promising. But the concern is, before the pandemic, we had about 40% of all migrants being women. But now after the pandemic, it has gone up to 46% being women. 6 percentage points have gone up.
And in Japan, I think it's similar in Sri Lanka, but there is a very strong persisting perception about the fixed gender roles at home. Like the women should take the primary responsibility of the domestic works or child care.
50% of women labor force participation legally government agreed by 2040. That is good target to achieve. Otherwise, any government might not focus very much women labor force participation. I think we have to focus. Government, all the programs, policies need to direct for many actions into the implementation.
One may argue that time to time the fertility may go up, but my own observation is that fertility will never reach again replacement. It will be every time for next 20-30 years, definitely it is going to be below replacement.
Also, Professor Indrala spoke about the unwanted pregnancies, the quality versus quantity, and we all are very much aware these unwanted pregnancies would end up in illegal abortion. So our laws pertaining to abortion is actually very restrictive, and as a result, we have to think of providing family planning services continuously. When it comes to teenage pregnancy, it means that children under 18 per month, 15 to 20 children who are getting pregnant.
And then I do experience every week I get at least 3-4 couples, young population. They want to get married and they want to go abroad. They come for some sort of a family planning method.
I think in terms of for labor force participation, there needs to be capacity building at different levels.
Even the migration, I mean, there's a whole care economy that needs to be studied, and keeping females at home or whether they go to work. Even we know that the nurses, so many are leaving. Why? Because they are looking after their children at home.
We are talking about and we are sharing the traditional practices of the country. Those things are changing. What the new generation knows about is and their attitudes and perceptions toward the population dynamic.
Hopefully you can be involved in shaping the future policies in this area. Thank you.